Cars flooded into American Legion Post 440 in Newnham on Thursday night for Understanding Single-Payer Healthcare for Massachusetts, a community forum hosted by MassCare 10th Middlesex District to help Newton voters better understand the policy.
With respect to almost every dimension of performance, our system disappoints the American need and is far worse than other countries of similar wealth. That's the bottom line.
Former Administrator of Medicare and Medicaid under Barack Obama, Dr. Donald Berwick, started out the forum by outlining some of the problems with the current healthcare system.
We rank about 40th in life expectancy, which, by the way, is getting worse year by year in recent years. Our infant mortality rates are the bottom of the OECD nations, the developed economies of Europe. Our health status is measured by the well-being of our children or the well-being of our elders is about at the bottom. Most comparative studies, and we have plenty of them, show us, for example, more recently for the 17 top OECD nations in wealth, we're 17, we're the worst.
Another speaker, Harvard medical doctor Gordon Schiff, spoke about his experience as a primary care provider with the current system.
So this is a patient, this is a couple of years ago, one of my most depressed patients, chronically suicidal patients, and I received this as an actual email. This is a picture of her email to me. Dr. Schiff, this is my final note to you. I've appreciated. So a suicide note by email. Fortunately or unfortunately, he says, I've appreciated your care as a physician, but I can no longer go to you. I've been saying it's not part of my network, it's not part of my plan.
Then it was time for audience members to ask questions of the experts.
A couple of years ago, my mother and my brother were both going through some health issues. My mother is on Medicare, my brother is on Medicaid. And I definitely saw a difference between the treatments that the two got and the ability to get the kind of doctors that they want and the treatment that they both received. So if we do go to a Medicare for all, can we be assured that it is Medicare for all and not Medicaid for all?
We generally always take money away from people that are at disadvantage. My own view, and we've written this in a policy statement in the Journal of Health Affairs, the country needs to bring Medicaid payment to Medicare levels. I guarantee there are processes in Medicare looking at quality of care that the private sector doesn't have never uses at all, Cigna, Aetna, United. We had, for example, I remember the day when running Medicare, I got a report from the Inspector General, Dan Levinson. Dan had done a study of over-sedation of patients in nursing homes, basically using chemical restraints, because Mrs. Jones tended to make a lot of noise, give her drugs, which is not legal, but it was being done. And Dan documented the extraordinarily high rate of over-sedation in nursing homes. Well, the day I got the report of the Inspector General, I phoned the head of the Nursing Home Association, the for-profit association, not-for-profit association, Geriatric Society. I said, please come to my office tomorrow. The next day, we had the leadership of care for nursing homes in America in my office as head of Medicare paying. I was their main payer. And I said, I held up Dan's report and I said, either you stop it or I will stop it.
MassCare volunteer and retired healthcare worker Bruce Fleischer, who also spoke on the panel, shared his organization's strategy going forward with a special message to local politicians.
You know, we need to get all the reps and senators in the State House on board, and in Newton they are not all on board, and we think we ran a non-binding ballot campaign in Middlesex 10, which is Rep. Lowndes, and it won by, I think, 68%. So we think people really want this, but the politicians are lagging behind. So we wanted to reach out to as many people as possible because most people want this, and we need more dialogue.
John Lawn, state rep for much of Newton and chair of the Healthcare Finance Committee, was in attendance, but he was reluctant to throw his explicit support behind MassCare's proposals.
So I think it's a bill that's been around the State House for a while, getting the support and getting a bill that Massachusetts can make sure that everybody has affordable access. As we know, it's a complicated system that we have built, can continually try to build upon. We're looking at costs of pharmaceuticals that are very high. We also know that we here in Massachusetts are the #1 place for innovation and in drug discovery and rare diseases. So, you know, it's a balance that we want to make sure we keep that innovation going, but also make sure that those drug costs are affordable for our patients to get them.
The fight for single-payer healthcare, both at the state and national level, is going to be a long one. But there were a room full of voters and elected officials alike just behind me here at this American Legion post that were very interested to hear the benefits of the policy from its main proponents. From American Legion Post 440, my name is Spenser Walsh for Newton News.